Hey everyone, it's One Sleeve Mama. I know it's been a few weeks, maybe even a month since I've done a video, so I wanted to do an update, especially since I am clearly in the hospital. But stats first. So I started in February 2015 at 256 pounds. I had surgery, gastric sleeve, on May 12th. 2015. I was 236 pounds, and as of a week ago, before I got in here, I was 178 pounds. So I've lost almost 80 pounds total, which is pretty awesome. In general, I feel pretty good. I don't have pain when I wake up in the morning. I'm in a size 12 pants for real, and a size large or extra large shirt. My bra size has gone down. I used to be a double D, and now I'm in a Victoria's Secret t-shirt bra size C, and they run a little differently than bras I used to be in, but after 2 hours of trying to find the right size bra, we found one. So that has shrunk as well. I have lost 5 inches in each arm. I've lost inches all over the place. I don't have the chart with me, obviously, but I can do another video later on inches lost, because I think it's really important to be measuring those as well, because a lot of times we may not lose pounds due to exercise or other factors, but we will see the inches move. And move is probably the wrong word. Fall off. I mean, inches are gone. They're not coming back. But like I said, size 12 pants, size large or extra large shirt, which is really cool. And I was feeling kind of grumpy a few weeks ago. I was wearing size 16 pants that I had borrowed from my sister, and some 2X type of shirts. And some of the boards suggested going and doing some retail therapy and finding what clothes actually fit in, so that I feel good about the clothes I'm in. I knew they were baggy, and that was not a mood lifter. So I did. I went to Target and I tried on a pair of 14s. I figured that would be it. And turns out I'm in a size 12, which felt really, really great. I don't remember the last time I was in a size 12. I really just don't remember. And I do have some extra large shirts of mine that fit, and then I went and got some other ones that fit better. Sorry, a nurse stepped in real quick to check and see how I was doing. And I'll get to that in a minute. But so overall, I feel really great. I've had a lot of non-surgical victories. Really obvious one is right off the bat here. I am in a normal person cuff, which is cool, and it wraps around really easy and has extra room, and they know I have the right blood pressure. When they say, do you have diabetes or any health complications, all I have to do is tell them, nope, but I've had the gastric sleeve. And they don't know a lot about the gastric sleeve here, so it is part of our role when we go into situations that we educate the staff and have them know what they need to do for our needs. I know there are certain pills I still cannot take unless they're crushed, liquid, or dissolvable, so I make sure that they do that for anything that can't go in the IV. And making sure I get my proteins, helping them monitor and make sure that they're doing that with me, and that I am getting enough liquids. I can't seem to drink enough liquids while I'm in here, so they're making sure to give the saline IV bags. But the reason why I'm in here is Monday, last Sunday, that'd be 5 days ago, I got this really bad migraine, and I just couldn't shake it. I took some of the Tramadol that I have for back pain and tried to relax the muscles. It didn't work. My mom gave me a massage with some biofreeze to try to relax the muscles and realized how hot I was. And I had 102-degree fever. And I didn't have any other symptoms, but I took some Tylenol and went to bed. My fever broke about 2 o'clock that morning, and I woke up fine. I felt okay, tired, kind of weak, but just generally okay. About 2 o'clock on Monday, I developed the same migraine. And I was rubbing my neck myself, trying to loosen it up. I had a lot of stiffness all through the neck on both sides, and realized I again had a fever. I took my temperature as 102, and that's a concern. Being that I've had the surgery, I'm extra aware of problems that may arise or complications, and I haven't had any yet, which is great. But I did make a common mistake and Google migraine plus fever and realized things can be available like meningitis, encephalitis, some really, really nasty things that you don't want to have. I talked to my parents about it. They said, just take some Tylenol, go to sleep. And I realized that this week I had a final exam coming, and I was supposed to leave today on vacation before my master's starts next week. So I didn't want to risk it. They told me I was being paranoid. I acknowledged they were probably right, and I went to the ER anyways just to get checked. As soon as I got here, they suspected sepsis. I was immediately put into a room. I was cold. I had severe chills, like down to the bone, and it was not cold in here. And I could not get warm. My neck was completely stiff. I couldn't really move it, and my fever was pretty high, even though I had already taken Tylenol about an hour before. So they thought sepsis. They took a chest x-ray, blood work. Sepsis was ruled out. That's a blood infection throughout the body that you really don't want. But they did find in the chest x-ray that I have pneumonia. It was kind of funny, and it shocked everybody because they tested the lungs like with the stethoscope and realized they seem clear in the front and back. They listened, they seem clear. I haven't had a cough, but yet there again in the right side pneumonia.
Hello. No food yet?
I'm sorry. Sorry, paused the video. They were checking for my food tray. So yeah, I have pneumonia without any symptoms. So, and I also had a UTI, which I have always kind of gotten pretty easy after the birth of my daughter. And so they said, well, that explains a fever and headaches. So we're cool letting you go home if you'd like, but there is the other possibility of meningitis, and we could do a spinal tap if you'd liked, but we really don't see the purpose of it, and they kind of left it on my plate. Being that I had the final exam coming for my last class and then a vacation to where I was going to go see my grandpa who just had a hip replacement, I figured better safe than sorry. Also, my kids are very young, so if I had meningitis and it was bacterial, that was really serious. That is really serious for them. So I wanted to clear it out. They tried 4 times to tap my spine and couldn't do it. So they kept me overnight to wait for radiology. Radiology in the morning, used the x-ray machines, and they found that I had low level count of viral meningitis. Well, it took them a few hours to figure out viral or bacterial, and to be honest, it's been 5 days here, and the infectious disease doctor and the normal doctor finally agreed on viral. The biggest part was they couldn't decide on what's going on. They knew I had a viral infection of the brain. They didn't realize why I have it, and they still really don't. The complication being that I've had this surgery, I've lost a lot of weight, so I don't know my normal stats on blood pressure. I don't have normal feelings in my body, like, are you normally rested? Are you normally... the other questions they asked, I skipped my mind, but I kept telling, right now nothing is normal. My body's adjusting to the new size. I haven't really had my blood pressure taken that much. I don't know what I should normally be eating because this is what I eat for post-surgery. And so I kind of confused them with that, and they were worried with how much I am allowed to eat. Am I getting enough while I have these antibiotics and pain medications? And are we going to cause other complications? Which, of course, worried me as well. So we spent the first 3 days trying to figure that out. And the doctor's going back and forth with, what does she have? What does she have? Well, Dr. 1 says meningitis. Dr. 2 says, no, it's not. It's encephalitis. And we're going to see that in the cultures in a couple days. We did 3 different brain MRIs, 1 without contrast, 2 with contrast. The one without saw encephalitis, the one with didn't see encephalitis. Sorry, the more I sit up, the more I get a little lightheaded. But, and then they're about to do another spinal tap tomorrow. And the initial spinal tap results from the cultures came back saying that it is not encephalitis. So they said I am free of another spinal tap, thank goodness, because those are not pleasant. And that basically the symptoms are going to last for a few days to a few more weeks. So here's the symptoms. Again, I get severe headache through temple to temple, right up this ridge. Neck stiffness at the base of the skull that goes down. My shoulders are sore, but that is probably due to stress. I carry my stress in my shoulders. And then my normal back pain from the degenerative disc disease is like flared up big time because the infection in the brain from meningitis is also in the spinal column fluid. That's the same fluid that goes up to your brain. So it has lit all of that up like a Christmas tree. The other thing is being sensitive to lights. I haven't had these lights on all 5 days unless a nurse absolutely had to in order to see what's going on. So the pain is pretty intense. They manage it with morphine, and now I've added Percocet to help because the morphine's not touching the headaches. I need to lie flat in order to let the headaches release, which is because of the pressure from the infection. That pressure goes down when you lay down. I wasn't able to do that for a few days because of the pneumonia and the restriction on my breathing, but now that is lifted. The pneumonia is still there, but the symptoms aren't, because I've been on antibiotics for that since Monday, and today is Friday night. So that's just kind of a rundown of how and why I'm in the hospital. The big thing is the emotional toll it takes, not understanding what is going on, not understanding how this surgery is going to, the gastric sleeve surgery is going to affect pneumonia and meningitis. How did I catch it? We still don't know. My kids are both in daycare or school, and they possibly could have had it. Most of us carry some type of this bacteria or culture in our meninges. They just don't transfer to the spinal fluid. because our immune systems block that. But definitely with the surgery and the UTI and the pneumonia, it allowed that bacteria to travel. So I guess a word of caution is if you have severe headache, sensitivity to light, stiff neck. I also threw up, but this one, there's not a requirement of meningitis. But if you have those three, stiff neck, sensitivity to light, severe headache, fever, number 4, anything over 101, get checked out, go to the hospital, make sure you're good, because those numbers can multiply rapidly. The side effects of non-treated bacterial meningitis or encephalitis are blindness, deafness, paralysis, death. I mean, they're big things. Last thing I wanted to touch on was kids. Luckily, I was on quarantine for the first 3.5 days here in case it was something bacterial. It means we kept a really close eye on my kids. They had a low-grade fever from something else they have that lasted the first day I was in here, and they've been fine since. Of course, they're cranky because they don't know where I'm at and haven't seen me. My family has luckily been taking care of them this whole time, but there is no way I could have been taking care of them with all of this going on. So I'm really lucky to have family that did that. And I've been reaching out to different boards and talking and seeing if anybody else has had this combination with the surgeries, and so far no one has. Now, of course, the well wishes and whatnot, but which I appreciate greatly, but no one else has seemed to have this combination. It's kind of weird. It's not surgery related, but it definitely is affected by the surgery. I'm a lot weaker because I can't eat like normal people would be. And they have to be more careful with the medications they give and whatnot. Second side note is yesterday was my birthday. So I had my birthday with meningitis and pneumonia, but you do what you gotta do. And on my birthday was my final exam. I had emailed my professor and I said, what do we do? Because I know grades are due by Monday, and my master's starts on the 10th, which is next Thursday. So I can't postpone taking this final, and I need to get it done. So she faxed it here to the hospital, and we blocked off all the different types of tests so that I had an hour clear of no testing and no medications while I did the exam, and I got it sent back to her. So that was kind of an interesting day. Everyone was kind of shocked. They're like, you do realize that this is a disease that is affecting your ability to think, your ability to read, sit up straight. Do you want us to talk to your professor? And I said, I would love that, except for I need to start my master's program, and I kind of have to take this test. So, just like all of you that go through your challenges and whatnot, anything that we put our mind through, we can do. Nothing has to stop us anymore if we want to accomplish it, we can. I definitely will be resting. I may be getting out of here tomorrow, since now they've definitely decided that's what it is, and there's no more further course of treatment. Now it's all pain management until the symptoms kind of subside. So unless a new symptom develops by tomorrow, I'll actually get to go home. My normal daily routine at home, just as an update, I do go hiking at one of the parks. I used to take like 20-25 minutes to do a lap around the lake, and I'm down to like a 16-minute, maybe even 13 if I run a little more. I kind of do the run a little bit, walk a little bit, and then when I get to the hills, walk the hills up because they're kind of steep, and then kind of jog my way down. I really do enjoy that. When school starts next week, I will be attending the gym and some of the classes, so keep posted, because as long as this is okay, I will start some of those classes, and you can laugh along with me, because I've never done gym classes, and it's probably been a good 8 years since I've been in a gym at all. So I'm looking forward to making a fool of myself, and looking forward to starting my master's and kind of getting better. But I wanted to give an update, and I'll do a video when this does clear up with some body shots and an update on weight. My guess is I probably lost 5 to 7 pounds being in here, because I've tried hard to be eating, but it's challenging. So that's the update of me. I hope everyone is doing well. If you have any questions, do leave me a message and I'll get back. Thanks so much. Bye.